Hi everybody, here we're going to do some video on myofascial release, working on trigger points and releasing tight muscles around the hip and pelvic area. Okay, our first exercise here, we're going to work on releasing the piriformis muscle, or the gluteal muscles, pain in the back of the hip, buttock area. We have just a standard foam roller here, and we're going to work on trying to eliminate some trigger points in those posterior hip muscles. So the basic technique here is just to be slightly tilted towards the side we want to work on. This leg's out straight. I have a little bit of support from my hand and my opposite leg. And basically you're just starting to roll a little bit and try and search for tender points in those buttock muscles. When you find a point, you have two choices. You could just exert steady pressure on the point for about 10 seconds and then search for another point, hold for 10 seconds. Or you can actually roll a little bit over the point. Whatever feels better to you, whatever feels like it's more effective for you is the right thing to do. This is a basic technique. If this doesn't feel deep enough, you can put some increased stretch on the muscle by crossing the leg over. This is going to put the piriformis on a little bit more stretch. Now I'm doing that same idea of searching for tender points right around that gluteal muscles. Again, you find a point, about 10 seconds, sometimes some slow diaphragmatic breathing, and just waiting for the muscle to soften and relax a bit. If I roll slightly towards the muscle, that sometimes is a more effective point. You can search for points by rolling forward, away, back, forward. You basically kind of want a search and destroy mission, just trying to search for those points and exert a little bit of pressure against them. This is a basic technique for the piriformis muscle. Okay, next we're working on some of the muscles on the side of the hip. So basically the lateral hip bone there, the greater trochanter we call it, just above that is the muscles that lift your hip to the side. So above that bony point that sticks out, but below the hip bones is a group of muscles that often can be sort of a culprit in lateral knee pain, lateral hip pain. So we start to work on these muscles a little bit by, again, just rolling back and forth. These muscles are only about that long, so you don't have to roll very far. If I angle a little bit to the front, I can hit the front part of those muscles. There's a second muscle in that area called the TFL, tensor fasciae lata. It's another one of these frontal side hip muscles that often is a culprit as far as harboring trigger points and tender points in the muscle. So again, I'm just kind of working back and forth over that area. If I find a point, I exert a little bit of steady pressure against it, or I can roll small little oscillations right over that point. And we're trying to wait for the muscle to relax into the point, a little less tender. Again, slow breathing can be helpful as well. Once we work on these muscles, we just kind of skip over that little bumpy point and come down onto the lateral thigh muscles. I'm going to move the roller down a bit so I'm still in frame. So these lateral thigh muscles can be a real common culprit of hip and thigh and knee, lateral knee pain. And right about here, midway down, is a common spot to have some tenderness, so I can kind of just roll on that spot a little bit. To get further down the leg, I just slide my body further up on the roller. Now I'm working those muscles just on the lateral part of the knee, the IT band on the outside of the knee. So this is a mobilization for the IT band, very useful for knee pain, hip bursitis, kneecap pain, etc. A lot of problems benefit from working on this IT band. This is an example of releasing some of the fibers in the IT band. Okay, next we want to work on some of the deep hip flexor muscles. These muscles lie inside the pelvic area. They connect the back to the hip. So people with back pain, hip pain, these are very common culprits to have some problems with. Getting into these muscles can be pretty challenging. They're deep inside the pelvis. There's a couple products that have come down the pike lately. This is a product called the PSO-RITE, P-S-O-R-I-T-E. It's used to try and kind of work into that area a little bit. This is actually sort of a less expensive knockoff version. If you go onto Amazon, you can find these products on Amazon. If you search for PSO-RITE, P-S-O-R-I-T-E, it's a way to apply some deep pressure into those muscles. Okay, so we're going to go ahead and demonstrate how to use these devices now. So again, this muscle's deep in the pelvic area. Unlike the foam roller where we're trying to roll our body weight over, this is just steady pressure. We're just trying to exert some pressure onto the muscle to get it to release or relax. So to use this PSO-RITE device, it's put on the floor like so, and we're trying to kind of get some weight over top of it. So I'm sort of trying to imagine my belly button would end up about in between the two little upward projections here, and these projections end up on either side of that belly button. And basically what I'm trying to do is just relax and allow body weight to sink down onto that. So as I sink down onto it, the two projections project up, push up into the abdomen area, And basically, you're just trying to kind of get up in there. You can adjust a little bit. If I walk down a little bit, I'm a little bit higher, and so forth. So over the course of maybe a minute or so, we're trying to exert some steady upward pressure. If I lift my knees off the ground, now I have a little bit more body weight pushing down. If that feels kind of good, that's cool. If it's the first time you've done this, I would say keep the elbows and the knees on the ground so you can control the amount of pressure on that spot. So roughly about 10 seconds on a spot, move a little bit, find a new spot, sink in roughly about 10 seconds. And this is a way to release some of these deep hip muscles that connect the low back to the hip. If you don't have one of these, again, they're easy to get. You can get them on Amazon. Some people will use a kettlebell handle on the kettlebell. Obviously, you can only get one side unless you put two kettlebells side to side. But basically, you can exert that same upward pressure, like so. So here I'm sinking down onto the kettlebell handle and trying to relax into it for, again, about 10 seconds or so. So this is a way to exert some pressure on that area. We're trying to wait for the muscle to release and loosen. Very useful for back pain, hip pain, FAI, femoral acetabular impingement, hip arthritis. Those will be examples of some of these stretches I've just shown you. Some of the foam roller work all have an application for those conditions. Thank you. If you'd like some more information, we'd like to check out essmc.com. We have quite a bit of information there. Our practice focuses on orthopedic and sports physical therapy, occupational therapy, work assessment and conditioning, athletic training services, speech therapy, concussion therapy, hand therapy. So we have quite a few different services available. They're all described on our website. If you'd like to call for information, 412-856-8060. Thank you very much for watching.